Today we're pleased to welcome Dr. Martha Nance, who will discuss team management of Huntington's disease. Dr. Nance has been the director of the HDSA Center of Excellence at Hennepin County Medical Center since 1991. She's the adjunct professor in the neurology department at the University of Minnesota and also active in clinical research. She gives frequent presentations at local, regional, national, and international patient and professional meetings. She's also the co-author of the Physician's Guide to Huntington's Disease and the author of the Juvenile Disease book. Before I invite Dr. Nance to begin, I'd like to take a moment to review how you can ask a question and how you can access this webinar after the broadcast. Questions will be answered after the presentation. However, you may send a question anytime. To send a question, just go to the control panel that appears on the right-hand side of your screen. You'll see a panel for typing in a question. Once you type it in, please just hit the send button. This webinar will be available on our website for viewing after broadcast. Approximately 48 to 72 hours you'll be able to access it online. To access the presentation, go to www.hdsa.org and scroll down to the home page until you come to the link for the webinar. You'll see an accompanying PowerPoint presentation that will allow you to print the slides, as well as a PDF of additional information. You can also access older webinars in the Living with HD section of www.hdsa.org. And now I'm pleased to welcome Dr. Martha Nance.
Well, it's my great pleasure to be here and give this presentation today. As Jane said, this is one of my favorite topics to talk about. We'll talk today about why one would want to have team care for Huntington's disease, what the components of team care might be, and then how to find and create your health care team. I think it's useful to consider first what the features of Huntington's disease are that determine what kind of care a person might need. And we'll talk about these briefly. So this is typically a disease that comes on during adulthood, although of course we all know that there are people who develop Huntington's disease in childhood. And so the things we're going to talk about today have to be modified a little bit if you're talking about a person with juvenile onset Huntington's disease. And Huntington's disease gets placed in different chapters in the medical textbooks. It is clearly a genetic disorder, and that's different from many conditions that doctors are accustomed to treating. It is a movement disorder, so many of the leading physicians who work on Huntington's disease in the United States are considered to be movement disorders experts. It clearly has some psychiatric and behavioral aspects, and so a psychiatrist might be involved in management. There are a few centers around the country and around the world where it actually is a psychiatrist who is the lead physician managing patients with this disease. It is a disease that causes dementia, and so it might be paired in some centers or some clinics with patients who have Alzheimer's disease. And there are a few of the HD experts around the United States whose other interest is in dementing disorders. It's a progressive degenerative disease that plays out over decades. It is a purely neurologic disease that generally does not affect other organs in any direct sense. So it's going to tend to be a neurologist or a psychiatrist who manages the disease in most centers. And finally, it is a disease currently for which there's no cure. It progresses inexorably until death. And so, again, the management is something that requires somebody who can stay with the patient from the beginning of the disease until the end. The goals of treatment, since this is a disease for which we do not have a cure, the goals are to reduce the burden of symptoms, to maximize a person's function, and to optimize the quality of life. So all of our treatments have to revolve around those three goals.